As far as the symptoms go, nausea is often one of them, so you can be prescribed nausea medication. I haven't for a long time, so I don't know what it's called, but basically what happens in the beginning is fatigue. You get really tired all the time, you don't know why. The diarrhea symptoms, multiple times a day, things just run through you. And then eventually the pain, abdominal pain for me, pretty severe, so severe that in high school I had to stop going to school because it was so painful. I had to, I wasn't on pain medication until close to the time of my surgery. I just kind of dealt with it. But eventually things become so inflamed that it starts producing scar tissue. So that starts closing a section of the intestines. So think of it as a round tube. It starts getting scarred along the walls. So it gets smaller and smaller and smaller so that eventually it becomes completely blocked. And so that's called a blockage. And that is where most of the pain comes from because things can't get through. There's something called a peristaltic contraction, which is that's how your food gets through the intestines. Your body just contracts and it just flows through naturally. And during each one of those contractions, kind of like labor, similar to labor, I just went through that, so I can say that. It's stopped. That contraction is stopped, and everything, all the food, everything is stopped in its place, and that causes a lot of pain. Which eventually turns to distension. You see someone who is really skinny and their stomach is, pretty distended, pretty out there, and that's because of the blockage. And so if they can't get things to turn around, they have to do surgery to remove that blocked and scarred and inflamed section of your intestines. And so that's what I did. They took me to Primary Children's, which is a great hospital, and performed surgery, and it was about 13 inches of my intestines that they removed. Things went great. They used laser, so I don't have a large scar at all. I just have multiple small incisions. And since then, I have not had any more surgeries, and I have been able to control things better with diet, which I didn't know about before. So one of the main treatments is an immunosuppressant drug, because it's your immune system, or at least I think, some people think, it's your immune system attacking itself. They can put you on immunosuppressants, so it suppresses the immune system. So theoretically, they think it would help with the symptoms in that way. So I'm actually on an immunosuppressant called azathioprine right now, and I have been for the last 10 years. And there are also medications that are injections, or they can be intravenously done monthly or things like that at an outpatient center. Those are called biologics. I've been on a couple of those before, Humira and Remicade. Those are used, again, to control some of the processes in the body that turn your body against itself. Those medications are also used for things like rheumatoid arthritis, other autoimmune conditions, things like that.